and reduced performance in athletes. So what I say now, when you go to the GP to get your iron tested, they may or may not do iron studies. You might just get a full blood evaluation, which will give you haemoglobin. So haemoglobin, the range is something like 115 to 200 maybe, depending on whether you're male or female. So when they do a full blood evaluation, they'll test your haemoglobin and it'll come out at whatever level. So I've seen people come out at 116 and be told you're fine. Because when you get your blood tested, it literally goes into a machine and spits it out. No one actually looks at your blood. Haemoglobin is an indicator of end-stage iron deficiency. You are anemic when your haemoglobin is low. So at 116, you're borderline anemic as far as I'm concerned. A lot of people don't come within this range, but have very low ferritin stores. So ferritin is your iron storage. This is a far better marker. So if you're going to the GP and you're wanting to really look at what's going on with your iron, ask them for iron studies as well as a full blood evaluation, or else you'll just get this picture.
Is hemoglobin the one they do
when you give blood?
Yep.
Yep. So again, end stage really tells you, and they'll only send you away if you're 114,
yep,
which is anemic. So it's borderline anemic when you're at that point. Serum iron tells you nothing. It could be, serum iron is just how much iron's in the blood, so that could be what you've eaten the day before. So that's a poor indicator. Ferritin is what you want to see, storage iron. Most people I see are actually low. These are your iron-rich foods. Good digestion also fundamentally important, like I said. Interestingly though, certain grains and beans actually have constituents that we call phytates, which impair iron absorption. So if I'm giving iron supplements, I'll always give it with an iron-rich meal like meat or fish and vegetables rather than breakfast, which is your grain meal generally. And vitamin C enhances the absorption of non-heme iron, which is plant iron. So I think a lot of people think, oh, I'll have an orange juice with a steak. The steak is heme iron. Vitamin C doesn't make any difference there. So it's only if you're eating spinach and you're wanting to get more iron out of your spinach. So for vegetarians, have some capsicum with your spinach because that'll increase your non-heme iron absorption. So B12, this is the other major deficiency, and it's becoming more and more common these days. It's an important cofactor in one of the pathways that we call the methylation cycle. Now, I'm going to try and put this as simply as possible, but the methylation cycle is needed for over 200 reactions in the body. And what we're discovering now is that methylation is dependent on B9, B6, B12, and another compound we call SAMI. So low levels of any of those nutrients can impair this methylation cycle. B12 is fundamental for this cycle to work. Poor methylators are associated with infertility, cardiovascular disease, and depression. So there are three major illnesses or states of disease, if you like, that are absolutely dependent on this methylation cycle. So if I'm treating someone for depression or even cardiovascular disease, infertility I personally don't treat, but a lot of because there's so many people out there who specialise in it, but they're one of the first things they test you for to see whether your methylation is working properly. So if you kind of go to your GP and you ask for B12, you'll get a good indication of what B12 might be doing. I always say, and I've got this on the next slide, always ask for red blood cell folate as well. So that will give you an even better indication of what your methylation cycle is doing.